We're back on later today, and this morning on Your Health, bad breath. Though it affects us all at one time or another, it's a serious problem for 60 million Americans. But it doesn't have to be. Here to tell us what causes this condition, also known as halitosis, and what cures it, is cosmetic dentist to the stars, Dr. Gregg Lituchy. Good morning, Dr. Lituchy.
Hi.
Oh, my
Nice to meet you.
You don't practice what you preach, do you?
No.
No, I'm kidding. No, but really, I'm going to give you the test. I mean, I'm going to breathe, and you're going to tell me the truth, okay?
Mm-hmm.
Be kind.
Sure. It's Weston omelet. It's toast and butter. Your breath is fine.
Thank you very much. But listen, what causes bad breath?
Well, bad breath comes from bacteria that live in our mouth, and these bacteria don't like oxygen, so they're hiding in the gums of the teeth, between the teeth, and most importantly, on the tongue, the back of the tongue, and the deep fissures of the tongue.
Well, Jody and Ash and I were talking about how would you tell someone, you know, supposing you did have bad breath, and, you know, how would I tell you?
It's a hard thing to do. You have to very quietly, I would say, go up to them and say, is that your feet or your breath that I'm smelling? That'll work.
Really?
Yeah. No, it's a hard thing to do.
It is.
There's actually a website called www.gentlehints.com. And what it is, it's a website where you can send a message to a friend or a family member that you can't bring yourself to say that they have bad breath, and for $12, they will email them and tell them for you.
I think it's kind of better if you just, you know, bite the bullet and tell them yourself. Well, how can you test to see if you have it yourself? I mean, I've seen people do that and all kinds of strange things.
Very often, if I'm washing my hands in the operatory, I'll see a patient, just see if I'm looking, and they'll give a quick test.
Does that work?
It doesn't work because your nose has become accustomed to your own breath. So you're not getting a real reading. The three ways that you can really test is using dental floss and flossing in your back molars and then smelling the floss.
Oh, how exciting.
Yes.
Can't wait
taking a washcloth and wiping the very back side of your tongue.
You mean?
As far back as you can go and smelling it.
Not bad.
And the best way is actually you lick your wrist.
Okay.
Like this. You let it dry for 2 seconds.
If people are tuning in just now, they're probably wondering, what in the heck are they doing? Okay.
And then you smell it.
Okay.
Would you?
You got a problem.
I do. Where are the mints?
No, I'm kidding. I'm kidding. Okay, so now we found out how to test ourselves. All right, now, 1 in 4 people have halitosis, right? So are these some of the things that we can do to help it?
These are, first of all, most people wake up in the morning with morning breath, as we call it. And the reason that happens is when you're sleeping, your salivary flow basically stops.
Okay, so what have you got here for us?
So what we have here is we have baking soda and hydrogen peroxide, which when mixed together and brushed on the teeth, oxygenates the mouth, and the bacteria don't like the oxygen, so it's help fighting the bad odor that you're getting from that. We have different rinses, which have antibacterial substances in them, which will also help fight the decay.
You have toothpaste.
And the toothpaste, and my favorite is the tongue scraper.
Now, I've never used one of these. Show me how this, here, show me.
The way you would do it is you stick your tongue all the way out, and you press, and you pull.
Good Lord, that's painful.
It will, well, I've actually removed little pieces of your tongue as well, but I got the bacteria.
Let me try this on you now. Okay, stick it out there.
This is revenge.
Yeah.
Just like that.
Look at that, it works.
Because the brush will not get deep enough into the fissures. That's why that works so nicely.
Well, we don't have much time, but tell me, now, I know mints are big, Altoids, all that kind of thing.
Those things are very good for a quick fix, 15 minutes, but then they really don't last much longer than that. But we all use them for ourselves and to give to whoever we're talking to if their breath is bad.
Now, I know that there are certain vegetables and things that you can eat. Parsley, I know, and you have other things
You want to stick with things that are very dark green because they have chlorophyll, which oxygenate the mouth as well.
All right.
And things that are very crunchy and dense and roughage, like apples and carrots, are wonderful because they take the plaque off your teeth as well. And drinking a lot of water, because dry mouth, if the saliva is not flowing, the bacteria aren't getting washed off, so you want to stay very hydrated and drink a lot of water. Okay,
I'm going to share a little secret with you. My makeup man at Paramount used to do this. He would take a little Banaka and just put it on your hand, and then you would do that. You want to try this and tell me if you like that?
Yeah, it's great.
You can share that with your patients at no extra cost.
I absolutely will.
Dr. Gregg Lituchy,
thank you very much.
So much. And we will be right back. Stay with us.